are you guys doing today? Good afternoon. I hope you guys are having a lovely day. We're here with our amazing Dr. Porter today. We're going to be asking her some questions, you guys. And of course, if you guys have any questions, you can put them in the chat. Any doubts, anything, you can put them in the chat, you guys, okay? So for everyone that's joining the live today, hi guys, how are you guys doing today? So let's start the questions. So the first question that I'm going to be asking Dr. Porter is, what is the maximum volume of fat transfer allowed by safety guidelines?
So the maximum in the state of Florida, everywhere you go, is a little bit different. But in Florida, if it's just the lipo and fat transfer, it's 4 liters. And if it's a combo, like a tummy tuck and BBL, it's 1 liter.
Oh, great. How do you correct asymmetry in a BBL?
Asymmetry?
Yeah.
So we look at the patient, obviously, beforehand, in the day pre-op, so the day before surgery, or if you have a consult, in the consult, and then we make our markings. Nobody's ever going to be perfectly symmetric, so we have to keep that in mind. And then on the table you can always be symmetric, but not all that fat survives, so we try our best.
Can a BBL be combined with a thigh lift, and how does that affect recovery?
I personally would not do that. Every surgeon is different, but a thigh lift is like a terrible recovery, I'm not gonna lie, because you can't really move that much afterwards. Very uncomfortable to sleep and stuff. I mean, you have these incisions here, potentially here, and then the BBL also, you're not putting weight on it for 4 weeks, so I think it would just be a miserable post-operative period.
Yeah, of course. How do you determine the ideal implant size based on a patient's anatomy?
So there's actually numbers that these implants are, and so the width of your breast, not like the width of your chest, but the width of your breast tissue. And you take a tape measure. You have to keep in mind that you have to leave like a centimeter or so on each side in the middle, so that you don't get the two, like, uniboob. And then you don't want to go out too laterally, because then the implant will fall laterally, like potentially once everything heals and loosens up. So you really want to make like the perfect pocket. It's always better to go smaller, and if you want to go bigger, you can go bigger down the road. Because when an implant is too big for your body size, you end up with that side boob that kind of doesn't fit. Then people say that it's affecting range of motion and stuff. You're always safer going smaller, letting the skin stretch. There's also potential complications like nipple necrosis and like exposed implant when we're really stretching the skin to put that implant in there.
Oh, wow. How do you prevent rippling in thin patients?
I put my implants under the muscle, so you're not really going to see rippling under the muscle, because the muscle is over it.
Great, doctor. Can you explain the en bloc capsulectomy for implant removal?
Yeah. So if you do have capsular contracture, which is where kind of like one implant or both potentially, there's different stages of it, but essentially the implant is kind of like stuck in place instead of being like soft and mobile like a normal breast would be. So regardless of if you have contracture or not, your body always forms a capsule. If it's contracted, that means that capsule is just firmer than what it normally would be. So we go in the same way that we would put in an implant or remove it, and we take out that capsule surrounding it as best we can, and then it's your choice if you want another implant or if you want a lift, or regardless.
So I actually wanted to ask you, how often should implants be replaced or monitored with imaging?
Yeah, so the FDA, I believe, says every 3 years you should get an MRI, and then the implant should technically be replaced every 10 years per the guidelines. And that's just usually because if something happens after 10 years, the cost of the implant is covered usually by the implant company. It's every 10 years.
Okay. What are the options for nipple repositioning during augmentation?
During just a plain augmentation, we don't touch the nipples.
Oh,
if you're
okay.
doing a lift, then that involves nipple repositioning.
And when a person is doing the lift, how do you reposition the nipple?
So that's what our markings, we look like mad scientists, you know, when we're swinging the tape measure from side to side and stuff, but that's what our markings are. Just we reposition kind of how the nipple should naturally sit for somebody who does, like before your skin started becoming more lax, just numbers.
So I actually have a question about breast lifts. What are the different incisions patterns for a breast lift? Anchor, lollipop, and donut? What are these?
So donut is peri-areolar, and unless you almost have no like ptosis or nipple, like the amount of like how far your nipple is sagging, unless it's like really, you know, 1 centimeter below or something, it's not a great option. And the reason is because eventually your skin does stretch out, and a lot of times the nipple ends up stretching, or the areola ends up stretching with it. A lollipop is just like around the nipple, around the areola, nipple areolar complex, and then down vertical. That can be used, and then the anchor, I think you said the last one was, the inverted T or the wise pattern, and that's probably the most commonly used and probably the most reliable, trusted.
Oh, great. Can a breast lift and augmentation be done simultaneously, and how do you plan for both?
Yes, they can. So again, we measure like the size of your chest. So for example, somebody that is, you know, 4'11" and very tiny, skinny, like a 200 or 250 cc implant in them is going to be very large. And someone like myself, I'm 5'9", I have like an athletic build, it would be tiny. Unless you have your own breast tissue. So, and then, you know, so we pick the right implant size with the patient, and then for the lift, we do the markings and stuff, so we plan just where we're going to locate the areola, the nipple, and what skin to remove.
So I have a question here that says, if you guys have any questions, you can put them in the chat, you guys. Any doubts, you can put them in the chat, and I'll be reading them to Dr. Porter, okay? So I have a question here that says, what's the difference between traditional vaser and laser liposuction?
So we don't do laser liposuction here. We have the power assisted, like micro air, and then you can add J plasma, and that helps with skin contraction. I think that's what you're getting at with the laser lipo. Sorry.
No, you're good.
And then the vaser does help like it burn and melt the fats via like ultrasound. It's just two different methods.
What is the safest technique for high definition liposuction?
Usually the vaser is most commonly used, and then power assisted lipo.
Okay, great. How do you prevent contour irregularities after liposuction?
So when we're doing the lipo on the table, we're constantly checking that we remove this, or you know, us surgeons, everyone is constantly checking that we remove the same amount of fat from both sides, and then afterwards, you know, we check for symmetry again, constantly checking, and then you can also use the cannula without suction to break up some of the areas, but you have to remember that nobody is perfectly symmetrical to begin with. We have to have realistic expectations too, and we talk about that in your pre-op as well.
So I have a question here that says, what are the signs of poor wound healing or necrosis post tummy tuck?
So there's like a few different levels of this. So poor wound healing, the tummy tuck is like kind of in line with the incision is kind of in line with your pubic hair. So it's not unusual to get a few like openings or pimples, like an ingrown hair or something, throughout, you know, the course of your healing. And healing, plastic surgery, cosmetic surgery lasts a long time, like about a year, you know, until you see your final results.
Okay.
So that's normal, as long as, you know, it's not getting like red or there's lots of pus or anything, then obviously that's a problem. Necrosis is when the blood supply is not good to that tissue. So if that happens, usually within 2 to 4 days after surgery, the area will become like red, then purple, then turn into a scab, and then that scab falls off, and it looks kind of scary because it's just open skin. But as long as that skin is clean, then it does heal. It just takes more time.
Can you explain the difference between expansion, vibration, lipofilling, EVL, and traditional fat grafting? That's a question. Or do you know, would you be able to explain what
traditional fat grafting? Yeah. So traditional fat grafting is we do lipo, and it can be done in the face, it can be done to the breast, it can be done to a lot of different areas that people don't think of. But when we're doing smaller areas, you just use like a cannula and a syringe, and you suction it out, and then you centrifuge the fat, and then it's just injected for BBL or for breast. It's a larger scale, so we're using just regular lipo. And then the fat is collected, it's strained, it gets antibiotics, and then it's put back into the buttock, hips area.
How would you say is the healing process for chin lipo?
It's pretty quick. I mean, it's your face, so if you do have important meetings or something, you might want like a week or two, depending on if you bruise a lot, to take some downtime. I only ask people to wear the garment for 72 hours, especially here in Florida or like warmer climates where there's no winter, that you could like get away with putting a hood or a scarf around. But then after that, just if you could wear it at night or something, but it's mostly just bruising and swelling.
Is it possible to perform a tummy tuck without drains?
It is possible. It's when people are local, it's very easy to do, or within a quick driving distance. But when or unless you're staying for a certain amount of time. But the problem is that the reason we use drains is for seroma prevention a lot of times, to make sure that the fluid is coming out, that it's not sitting in there. So if you are traveling and you have, you're not able to stay that time, or sometimes they can develop later, then you have to make another trip back for us to drain that seroma.
Yeah, so drains are important, you guys, to prevent seroma. I have a question here that says, how do you handle excess skin on the sides or flanks during an extended tummy tuck?
So the way that we do a tummy tuck, and again, it depends on the person and stuff, but usually we're pulling in that, and then the way that we suture, kind of everything pulls in, and then it flattens out over time. If you do have just like a ton of extra skin, it's up to you to see how your results would be, but there is like a fleur-de-lis tummy tuck, but that involves a very large incision here and here. Sometimes there can be dimpling from the scar. It's not as easy to hide, so it all depends on if that's something that you want to do, or live with.
How long should a person wait to get another round of a BBL after their first round?
So the first round, we're really sucking out as much fat as we can or legally can. So you're not gonna have much fat unless you gain weight, We can always find places like thighs, arms, but if you really are expecting like a lot more volume, then you need to go on like a BBL diet and gain some fat back in the original area. So however long that would take you.
Of course. So you would say that maybe a year would be safe for them to get?
Depends on the person.
If they even have enough fat, right?
Yeah.
Yeah, okay, great. So what compression garments do you recommend during the faja, and for how long should a person be wearing their faja for a BBL?
So I like the garments that we have here. I think most of these garments nowadays are made in South America, Colombia usually. And people always complain that like I'm not a 4XL or something, but these sizes are different and people really swell during that first month. So you want something that's comfortable. So ideally when you're getting fitted, it's a little bit loose on you. And then you're gonna be stuck with wearing like for the first month 24/7, and then after that first month, months 2 and 3, I ask that you wear 12 hours on, 12 hours off. If you feel that you're more swollen, you should just keep wearing it.
Okay. What is dual plane placement, and when do you recommend them when performing a breast augmentation?
So a dual plane is when it's like it's on the implants under the muscle, but you're also removing some of the gland like from the muscle fascia. If your nipple is a little bit lower than it should be, that's usually when the best time to put it.
What techniques maintain blood flow to the nipple areola complex during a breast lift?
So during a breast lift, you're not really disturbing the breast tissue, because ideally you're not really removing much of it, so you don't have to, there's always a risk when we're messing with blood supply, but every surgeon has a different preference of what pedicle they prefer. This is like super important during a breast reduction. So there's like the classic, which is inferior pedicle. It's like the traditional like academic way to do it. There's superior pedicle, which I like superior medial. As if somebody wants to remove like as much breast tissue as possible, usually superior medial. There's a ton of different variations, but just making sure that one of the major blood supply is intact.
Okay. What's the best approach for combining a lift with fat grafting to the breast?
To the breast?
Mm-hmm.
You can do it anyway. You could technically do it with implants too.
Would you say implants are a better option than fat grafting?
So they give you 2 different results. So fat grafting, every time we fat graft, about 50% of it doesn't survive, and that's to the buttock, anywhere that you put it, so you try to overfill. If you have a good shape to your breast, if you're happy with the, where your nipples are, or like kind of the volume, but you want to add another cup or something, then fat grafting is a good option for you. However, you have to keep in mind that 3 months later they're not going to be as perky as they were right away, and that's with a lift too. But an implant is going to give you that upper pole fullness, and it's going to stay there. So
okay, so we have a question here that says, let's say I wanted to get a breast lift and I want to reduce my areola. How can you do that? How is it done?
So it's always done. Most women have like their areola is bigger than the size for like the ideal areola, so we use a tool in surgery called the cookie cutter, and it's measured the same. That's actually the first step.
So this is going back to the question about how implants and fat grafting gives you a complete different result. So what happens if a patient wants a breast lift but also wants super upper fullness without implants? How would you explain that to a patient?
So the only way that you can 100%, everybody's gonna have a different opinion, but from what I've seen, that you can really guarantee upper pole fullness is an implant. And if you have your own breast tissue and we place it, if you want an implant at the same time, if you have a decent amount of breast tissue, I'm going to place like a moderately sized implant first, and then if you're still unsatisfied, you want the bigger, then we can go for a bigger implant. But you have to keep in mind that like the bigger the implant, the more it weighs, and if we keep your breast tissue too, it's going to weigh as well. So the implant is really the best way to go.
Yeah, you guys, so for volume, if you want that lovely voluminous look that all women we love, right? Implants, it will be the best option for you. So how do you address extreme breast ptosis, severe sagging?
Yeah, so it's common in women and older women, and after breastfeeding especially. That's that like the inverted T mastopexy is the breast back there.
Okay, great. What areas of the body respond best to liposuction?
You can lipo any area. The only time that it gets a little bit tricky is if you've already had lipo done in that area. I mean, it's still possible, it's just your body has more inflammation. It's a little bit harder.
Of course. How can you prevent fibrosis after your liposuction?
So there's always going to be some degree of fibrosis because that's how liposuction works, and that's how your skin, some of it, liposuction doesn't really fix your skin, but it can, contract if you have good skin. But the massages are good. That also helps get all the extra fluid out, and just being mobile, being active.
How do you handle stubborn fat pockets that don't respond to lipo?
I haven't incurred that usually.
You see, guys, she does lipo amazing. So this question was because I've seen all your patients and they're all snatched. So I know you don't deal with this kind of stuff, but that was a question that's why I wanted you to say how you really, really snatch your patients, you guys. So you want a lipo and you want your waist to be tiny, come to Dr. Port. Okay? So what post-op care reduces swelling and bruising on your back and your abdomen?
So the swelling, the massages help get some of that fluid out, and then you can use arnica tablets or gel they have, but that can help with the bruising as well. But I mean, part of the post-operative period is inflammation, so you can try to speed it up, but it's still going to happen.
Of course. Can liposuction permanently change body proportions?
So we're getting rid, again, liposuction's not going to get rid of skin. So if you're coming in and you have like a lot of intra-abdominal fat and excess skin and you just want lipo, that's fine. But will it give you like the original shape that you had when you were younger? Probably not, because you will have a better shape, but you're still gonna have, if you have intra-abdominal fat, so stand in the mirror and suck in, and if you're still round, then that weight can only be lost by diet and exercise, or the GLP-1 inhibitors are super popular right now, but so that's a way to lose it. For extra skin, that has to be excised. Nothing is ever gonna change, because we're not changing anything about your bone structure or anything, we're just accentuating what you already had.
Of course. So for example, let's say a patient comes in and gets liposuction, and they get liposuction, lipo 360, and they get lipo inner thigh. But then as the years go by, when they gain weight, where they gain more weight on their arms, on their upper back, or gain weight overall?
It depends. I mean, I've seen both. There's some people that don't really gain weight where they had lipo and it goes to other places. I've also seen people that have definitely gained, the lipo weight back. So, you wouldn't want to buy a new car and trash it. You want to take care of, this is an investment, you want to take care of your results.
Of course. How does ultrasound assisted liposuction work?
Ultrasound assisted lipo. I don't use ultrasound assisted lipo. Are you talking about for fat grafting?
Yeah, like lipo 360 and BBL.
Okay. Oh, so it's just for the fat grafting. So when we can scan the anatomy beforehand of the buttock and the hips, and then when we're injecting, we can see the layers of superficial, deep fat, muscle. So it just helps us to where to inject.
Great. So we were talking about earlier the process of high definition lipo. So how do you give those beautiful lines to these ladies and everybody? How do you perform those gorgeous lines? How does the patient get that result from it?
There's a few different ways, but for high definition, you're going like more superficial, and you're using a device to help with more skin contraction as well, and some people potentially maybe are leaving a little bit more fat behind in certain other areas to give more of an illusion of that sculpting.
So going back to BBLs, what is the role of pre-expansion techniques for patients with tight skin?
So usually before we're, injecting fat, we're breaking up that subcutaneous tissue to try and make space for it. But if you really have, tight skin, there's some people who just, that's the shape you're gonna have, and it'll get a little bit more volume and stuff, but we have to be realistic about our results. So
Of course. So for somebody that wants to get a BBL, but they don't necessarily want to inject on their buttocks, they just want to fill in their hip dips, could they do that? Would that still be considered a BBL?
yeah, you could. Just fat grafting to the hip dips would be, yeah.
Okay. And also for a BBL, can you add arm lipo and chin lipo if you wanted to?
Mm-hmm. Yeah.
So for like a thin patient, let's say, you have a very low BMI, so you have low body fat, would they be able to get, fat from these other places?
Yeah, so, yes, you can get fat. I mean, the chin's not really going to give you,
Yeah.
it's going to give you like maybe one pass. But for, arms, thighs, and, it's when you're in person, it's really easy to see where your fat is distributed. But a lot of people, even thin people, hold fat in their lower back, like right above their butt. And, a lot of people who are thinner, are in better shape, who want a BBL, you do the lipo, and halfway through, it looks like they got a BBL already just from removing that fat there. So it's like a pseudo BBL almost.
So when a patient comes to you and they had a breast augmentation with another doctor previously, how do you address bottoming out, implant shifting too low?
So that means that you kind of have to recreate the IMF to, or potentially put them, if it was submuscular, put them subglandular.
Yeah, of course. So, but this is something that can definitely be fixed, right?
Yeah,
Yeah.
most likely. Again, if that's you, then schedule a consult.
Yes, you guys. All you have to do to schedule a free consultation with us, whether that be in person or virtual, all you guys have to do is put your information right here in the left bottom corner. You're going to see this blue folder. You can put your name, your phone number, or your email, whatever's the best way to get in contact with you guys, okay? So, how do you manage nipple sensation loss after augmentation? You mentioned earlier that you don't place the implant through the areola, or is that something that can be done?
There's always a risk of nipple sensation loss, especially if you're going with like a very large implant for your skin. So that's just you can become hyper or hyposensitive. Yeah.
Okay. So, I think I asked you this question earlier. What are the chances of nipple necrosis and how do you prevent it?
So again, that's always, with surgery, there's always potential complications, and that's unfortunately one of them. But we try to use the correct pedicle. Where it really kind of gets a little tricky is in these multiple revisions, especially if you don't have like the op report from the pedicle that the surgeon had used prior, or just like this, so you have to give it a decent amount of time before you can do anything again. And just sticking to that pedicle, making sure that there's enough breast tissue left.
So you guys, any questions
no
you guys may
smoking.
have, and no smoking. Why would you say no smoking?
Because that constricts the blood supply.
Oh
So,
wow! And that comes with any kind of surgery, right?
Mhm.
Not just BBLs,
with
breast
any
augmentation, with
surgery,
any.
yeah.
So you guys, it's very important. Dr. Porter is here saying how it's so important that we're not smoking because it can damage our bodies and do, I'm sorry,
Can constrict the blood supply.
yeah, constrict the blood supply, you guys. So any questions you guys may have, we have a couple more questions left for Dr. Porter. So this is your chance right now, you guys. She's right here. You can ask her a question, okay? So when a patient goes to someone else, for a breast lift, and now they come to you and they're saying that they have like a boxy breast shape, how do you handle this kind of situation?
I would have to see the patient. Everybody's different, but either potentially a lift or different implants or something. Yeah.
Okay. So, what post-op measures help prevent hypertrophic scarring?
Hypertrophic scarring. So there's really nothing that can prevent it. If you heal that way, you heal that way. But you know, the minute that you realize that it's raised, or potentially if it's just like lipo incisions or something, you can put steroids into the incisions at the time of operation, but ideally you have to keep coming back. So once you realize that it's raised, every 4 to 6 weeks, you can try injecting steroids to see if that flattens it or stops the growth. If not, you can try re-excising it. Is it going to work? If it happened the first time, it's probably going to come back. So it's just unfortunately frustrating to deal with.
Of course. Can a breast lift correct tuberous breasts?
Mm-hmm. Yeah. So an implant can too. You just have to break up some of the tissue.
Of course, you guys. So as how she was saying, it's not always just a breast lift. I feel like a lot of women believe that they need a breast lift right away, but would you say that sometimes an implant can do just as much as the job?
I wouldn't say that. It depends on like the location of where your nipple is really, or sometimes like the glandular tissue is hanging low. Yeah, so I mean, every patient is different.
Of course. How do you address lateral breast fullness?
Like that you don't want there, or you want lateral?
Yeah, so let's say after a breast lift and they with another surgeon and they wanted more projection, to wear with tops and stuff like that, and they don't really have that side boob that they were hoping to get. So how do you perform the breast lift for them to be able to have that side boob that they want?
So the lift isn't really, because that's just rearranging your skin, and you want to take as much out that's safely possible at the initial surgery. And rearranging like where your nipple sits. If you want more, volume of your breasts, then you need an implant. If you're not satisfied with the implant size, then you need a bigger one at that point. Your skin has stretched out, and you can probably handle more volume.
So, this is the last question we'll be asking Dr. Porter. You guys, any questions you guys may have, put them in the chat. Would you say, what's the difference between general anesthesia and local anesthesia, and which one do you use and why?
So in my career, I've used both. Here, mostly general. So general anesthesia, you're not breathing on your own. There's a tube, there's a machine that's doing the work of breathing. There's an anesthesiologist or anesthesia provider in the room who's managing you while you're under. That being said, for more extensive procedures and stuff, and you can be totally relaxed because you can be paralyzed, so for like muscle plication or under the muscle for breast, there are people who do it without, and patients are happy. But local anesthesia, you're totally awake, you know exactly what's going on. You can listen to music, whatever, during, to make you feel more comfortable, but we use like a tumescent solution for that, for either, but the tumescent, if you're awake, usually has a little bit more lidocaine in it, so it's lidocaine, epinephrine, bicarb, and mixed in saline solution, and that helps numb the area that we're working on.
Okay, great. Thank you so much, Dr. Porter, for being here with us today. Thank you so much for your time. And you guys, stay tuned because we're going to be coming back with a lot of new information and exciting news that you guys do not want to miss out on, okay? Thank you so much again, Doctor.
Thank you.
Bye, guys.